Giving information. This is a therapeutic communication technique utilized by the nurse in order to inform the patient in form of facts that in any way will increase his knowledge about a topic, or this is to let the client know what to expect while he is under the care of the facility. Let us try to look at how the nurse will try to give information to the client. My name is Nurse Vincent, and I want you to know that the visiting hours in our facility would be from 10 o'clock in the morning to 12 o'clock. My purpose of being here is to let you know that we care about you. In the end, the nurse is functioning as a resource person. He will be giving information as he is trying to build the trust with the client. The nurse will make available facts for the client's consumption. And this therapeutic communication technique is called giving information. Giving recognition. This is a therapeutic communication technique that shows acknowledgement or awareness that the client is there right in front of you. You are trying to, from the word itself, you are trying to recognize a person, a client as a person or as an individual. Now, this can be done either by greeting the client by name or indicating your awareness of the change in the appearance or emotion of the client. Or you may note some effort that the client has made. You try to recognize that. Although giving recognition does not carry the notion of value, that is, of being good or bad. Let's pay attention to the nurse at the left on how he will use giving recognition as therapeutic communication. Good morning, Mrs. Smith. You are finished your list of things to do. I noticed this morning that you comb your hair and you are in a hurry. Why so, Mrs. Smith? In the end, recognition highlights the patient behavior without giving any overt compliment. It will draw the attention of the patient to action as well as encourage her without requiring any compliments. And that is giving recognition as a therapeutic communication technique. Making observation. Therapeutic communication technique that makes you verbalize what you perceive as a nurse. In this therapeutic technique, sometimes the client cannot verbalize or make a comment for themselves or express themselves to be understood, or the client may not be ready to talk. Indeed. Now, in this therapeutic communication technique, the nurse must be able to notice appearance, demeanor, or a behavior of a client. Let's give our attention to the nurse at the right side on how she will make her observations of the patient. You appear to be tense. Are you comfortable when somebody is staring at you? And I noticed that you are biting your lips. In the end, making observation will draw attention that might in any way pose a problem to the patient. And this making observation can lead to the discovery of any other condition that the patient may be suffering from. And this is making observations made by the nurse as a therapeutic communication technique. Offering self. A therapeutic communication that the nurse is doing and offering. In this therapeutic communication, the nurse is offering her presence, her interest, and desire to understand the patient. But take note, it is important that the offer must be unconditional. And in this sense, the client does not have to respond verbally or to get the nurse's attention. Now, let's have a look at the client at the left on how she will utilize opening self as a therapeutic communication technique. I would like to sit with you a while, and I want to stay here with you. Would that be okay? Because I'm interested in what you think. In the end, opening self is a gesture made by the nurse by making herself available to the patient. Placing the event in time or sequence. A therapeutic communication technique utilized by the nurse. This is in order to clarify the relationship of events in time, as simple as saying the chronology or how are the events arranged according to their proper sequence in relationship to time. And this can clarify some nurse and client perspective on the cause and effect of the situation. Now, let's hear from the nurse at the right side on how she will ask questions in relationship to placing event in time or sequence. What seemed to lead up to this kind of situation? Was this before or was this after? Now, when did this happen? In the end, the nurse will gain an information about the recurrent pattern of themes or the patient behavior and the patient relationship with the events. And this is therapeutic communication technique called placing the event in time or sequence. Presenting reality. A therapeutic communication technique that is most often being used by the nurses. This is when the situation of the client is too obvious that she is misinterpreting the reality. In cases of hallucinations and delusions, the nurse can indicate exactly what is real, what is true from what is untrue. But remember, nurses, you have to do this in a very calm and a quiet way of expressing your perceptions of the facts. You don't have to argue to the client, or you don't have to belittle the client with her expression or experience. Now, let's pay attention to the nurse at the right side on how he will use this presenting reality as a therapeutic communication technique. There is no one in the room. That sound was a car backfiring. Oh, your mother is not here. By the way, I'm a nurse. In the end, the intent of the nurse is to indicate an alternative line of thought. And this is for the client to consider, not necessarily to convince the client that reality is that she is wrong with her perception. And this is presenting reality as a therapeutic communication technique. Reflecting. It encourages the client to recognize and accept his or her own feelings. In this situation, the nurse will indicate to the client that he has a point of view and value, and that he has the right to have his opinions, make his decision, and he can think independently. This is what reflecting wants to assert to the client. Now, let us give our attention to the conversation between the nurse at the left and the patient at the right. Nurse, do you think I should tell the doctor? Do you think you should? My brother spends all my money, and then he has the nerve to ask for more. Oh, this causes you to feel angry. In summary, the patient will ask for the nurse's advice on his problem or for every specific situation. The patient will feel that he must be accountable for his own action and help must be there for him to cope up for a solution. He himself, and that is reflecting, directing the client's action, thoughts, and feelings back to him. Restating, a therapeutic communication technique that allows the nurse to repeat the main idea that has been expressed by the patient in a very approximate or a nearly same words that the client has used. And this is another way of saying it, the statement of the client is being restated. This is to let the client know that he communicated effectively. Now, let's pay attention to the conversation between the nurse at the right and the patient at the left on how the nurse will imply the use of restating as a therapeutic communication technique. I can't sleep at night. I stay awake all night. You have difficulty in sleeping? I'm really mad. I'm really upset. Oh, you're really mad and upset. In summary, restating will express the idea of the patient, and this will encourage the client to continue. Or the client has been misunderstood. If the client has been misunderstood, then she can clarify his thoughts, and that is restating. Seeking information as a therapeutic communication technique. This technique will allow the nurse to seek the clarification throughout the interaction. And the nurse does this in order to avoid making assumption when understanding has occurred, well, in fact, it's not. Now, let's give our attention to the nurse as to how he will use seeking information as therapeutic communication technique. I'm not sure that I follow, or have I heard you correctly? In the end, seeking information is necessary for the nurse in order to make clear those statements that is not meaningful or I may say vague. And for the client, it is important for he may articulate his thoughts, his feelings, and ideas more clearly. This is seeking clarification. Suggesting collaboration. A therapeutic nurse communication technique where the nurse will offer a relationship with the client that can identify problem in living with others, or for the client to grow emotionally and improve his ability to have a satisfactory relationship. In this case, the nurse offers to do things with rather than that for the client. Now let us hear the nurse as she utilizes suggesting collaboration. Perhaps you and I can discuss and discover the triggers for your anxiety. I think we better go to your room and I'll help you find what you're looking for. In the end, suggesting collaboration will offer to share, to strive, and to work for the client benefit. Summarizing as a therapeutic communication technique. Summarizing will bring out the important points of the discussion, and the patient as well as the nurse will have an increased awareness. They can both omit irrelevant as well organize important aspect of interaction. Both of them will depart or will end having the same ideas. And to the nurse and to the patient, there will be sense of closure and completion. Now, let's hear from the nurse as to how he will use summarizing as a therapeutic communication technique. Have I got this straight? You've said that during the past hour, we just have discussed, you and I, we have completed all this information. In summary, summarizing can organize and sum up those points which has gone before or earlier. And this is summarizing. Translating into feelings. This is a therapeutic communication technique where the nurses open once the client says. When taken literally, this will seem meaningless or far removed from reality. Now, to understand, the nurse must concentrate on what the client might be feeling to express him in his way. Now, let's take a look and listen as to the conversation of the nurse and the patient. As the nurse uses translating into feelings as a therapeutic communication technique. The client says, I'm dead. And the nurse says, are you suggesting that you feel lifeless? I'm way out of the ocean. You seem to feel lonely or deserted. In the end, translating into feeling will seek to verbalize the client's feeling that he expresses, but that is only indirectly. Verbalizing the implied as a therapeutic communication technique. In this technique, the patient is uttering an implied words. That means the indirect statement that covers the information or the covert information. To the patient, he wants the discussion to be blunt or obtuse, meaning he wants a less informative communication. And in doing so, the nurse will have to direct the communication by using verbalizing the implied. The nurse will communicate the information directly. However, in the process, the nurse must observe that he must only translate the fairly obvious statement of the patient, or otherwise, the nurse may be jumping into a conclusion. Now let's have a look and listen as to how the verbalizing the implied will be used by the nurse in order to come up with an important communication. I can't talk to you or anyone. It's a waste of time. Do you feel that no one understands? In the end, verbalizing the implied will be voicing the client's hidden information or the indirect information. And the role of the nurse is to translate or to verbalize those hidden information or implied information. And that is verbalizing the implied. Silence as a therapeutic communication technique. Silence is the absence of any verbal communication, and it encourages the client to verbalize, making him interested and expectant. The client will have now the time to organize his thoughts and direct the topic of interaction. It is as well a time to focus on issues which is most important. Much nonverbal behavior takes place during silence, and in the case of the nurse need not to be aware of the client or his or her own nonverbal. And for the client, she needs to say nothing but to continue to maintain the eye contact because this can convey interest. In summary, absence of verbal communication can provide time for the client to put the thoughts or feelings into words, regain composure, or to continue talking. This is silence. Voicing doubt as a therapeutic communication technique used by a nurse. This technique is used by the nurse in order to respond to a client who is having distortion of reality, meaning the nurse will express her doubt. And the thing here is that the client will become aware that it is only her who perceives the situation. However, this does not mean that the client will alter her point of view. What is important here is that the nurse will encourage the client to reconsider or reevaluate her point of view. And in the process, if the nurse is expressing her doubt, it does not necessarily mean that she agrees or disagrees with the client. She has let the misperception or distortion pass without a comment. Let's take a look and listen as to how the nurse will state her voicing doubt. Isn't that unusual? Really? That's hard to believe. In the end, voicing doubt is the nurse's way of expressing uncertainty about the reality of the client's perception. And this is one of the techniques that the nurse may use, the voicing doubt.
That's all, folks. This has been your nurse Radiologico Guro saying thank you for watching and enjoy studying.